Americans living without health insurance, that's not a new topic of discussion. But with the number of uninsured growing to more than 44 million, it's become more difficult for the policymakers to just ignore.
Local News 8's Esme Carriega attended the Republican Women's Club luncheon where they discussed health care issues and brought up some concerns they have to elected leaders. Esme.
You either live below the poverty level or make a smidge too much for government assistance. And that was the hot topic today. The purpose of the conference today was to educate themselves on a couple different ways to pay for the medical care for the people in that gap.
There are many folks in Idaho who do all they can to work and provide for themselves and their family, and yet they're left without any options for health care. They can't get commercial insurance, and they can't get Medicare, and they can't get Medicaid. And we need to reach out and try to fill that gap.
Currently, the counties and the state have a catastrophic health care fund for them, but it costs local taxpayers millions.
Yeah, it's a major issue because it costs the property taxpayers and state taxpayers a lot of money from the local perspective, but also the catastrophic program has been up in the $30 and $40 million a year expenditure for the state.
But there may be another way to pay for it, and legislatures are juggling those two choices.
Whether or not we want to fill that gap with Medicaid or continue with our current county and catastrophic program that we have to cover that population.
Legislatures are considering a request to the federal government to allow Medicaid to pay for insurance for the people in that gap. That would save taxpayers from contributing property taxes and to the catastrophic health care fund. But some are opposed to the expansion of federal programs and the strings attached. Now the legislature will make that final decision next year. Reporting from the newsroom, I'm Esme Carriega.
Thank you, Esme. I know that'll be a hot topic this next legislative session, so I appreciate the update on that. Also in Utah, they're having similar struggles with the Medicaid expansion. Well, time now to check